I had been a nurse for almost 6 years when we were hurt. I did 3 years in a surgical ICU, and then I did like 2.5 years in a bone marrow transplant unit in Boston.
Now, as I understand it, you weren't actually in the marathon. You were at the
Finish line. Yeah, the bombs were really intentionally put in the crowd where it was very tightly packed. So no runners were hurt in the way that people in the crowd were. They might have had some shrapnel or hearing damage, but the really critical injuries were those of us that were at the finish line.
Your husband was beside you?
Yes, we were right next to the first bomb. There's no real procedure for how to handle something when these terrorist acts happen to civilians. My purse blew up, our phones blew up, and I maintained my consciousness, but my husband was bleeding out, and so he lost consciousness and showed up at the hospital with no identification and was unable to speak for himself and didn't have me with him anymore. He ended up being identified by his wedding band. It had our initials in it and our wedding date, and his mom was eventually able to give that information, I believe, over the phone to the nurse taking care of him, and they realized this must be your son. So that's a really powerful, but obviously very emotional story to reminisce about, because the ring hadn't been on the finger all that long. We had just gotten married and taken our vows, and when we said in sickness and in health, I think both of us envisioned the sickness being way down the road. Never did we imagine it would be within that first year of marriage. The first responders at the scene did an incredible job getting everyone first aid, getting them off the street, and then deciding who was most critical and who needed to get to the emergency room first. I think that's why every person that was transported to the hospital survived. And out of 200 some people, it's pretty phenomenal.
Now, as a critical care nurse, you would know a lot of what was going to happen, and even not knowing how critically you were injured. I think I heard you say before that you were kind of calling out some orders that you needed this and this.
Well, I just was trying to get out of the way. I realized it was such a mass casualty situation that if I could tell them my blood type so they could use the unmatched blood for someone else who was unconscious, I was just trying to be helpful, but not in anyone's way. Because I realized very quickly after we were hurt that I was not going to be a nurse in this role. I tried to get up right after the blast went off and I couldn't even stand. And then a bystander told me that I was on fire. I didn't even know it. So it was clear very soon that I was way out of my league here and was going to need a lot of help. So I think my mind was just trying to be helpful in that scenario.
Your recovery period took a long time. Being on the other side of the bed rails for a nurse is a very different experience.
Yeah.
What are some of the lessons that you learned?
I learned a lot of things that I had been saying to patients or trying to calm patients down from. Looking back, I understood what they needed and what they were saying. So for example, I can't tell you how many times I transferred a patient out of the ICU to the floor and they almost never wanted to go. And I would say things like, but this is good news, or you're getting closer to home. This means you're moving forward. But when I found myself in the ICU for weeks and then I was about to be transferred to the floor, I didn't want to leave. And I finally understood that it's not a hesitation to want to move forward. It's that you've learned to trust and love these people that have been taking care of you, and it's scary and emotional to leave. Another kind of funnier example is a lot of my patients would tell me, I have a Foley, but I feel like I need to urinate. And I would explain to them, there's a balloon and it sits in your bladder and it's draining your urine, and I can tell that it's draining here. But when I had a Foley, it all the time felt like I needed to urinate, and it drove me crazy. And I just would lay there and kind of laugh to myself about all those patients that I don't think I brushed them off, but I didn't necessarily believe them. So there were a lot of cases like that I just learned that PICC line insertions hurt, and I would tell my patients, oh, the numbing medicine will sting, but then you'll just feel pressure, So there was a lot of cases like that.
What are your most vivid memories?
Well, in preparing for today, I really reflected on my initial ICU stay. And our initial hospitalizations, I think, were like 5 or 6 weeks long. And What I really remember are these small moments of just gentleness and kindness where my nurses would turn me at night, and it was so painful and excruciating. And they were obviously trying to prevent bed sores and my burns from worsening, but just like rubbing a cool cloth on my back. And it just, at a time where I was in so much pain and so much discomfort, to have that moment of that cool cloth on my back, I'll just never forget it. Their smiles, they brought lightness to a lot of moments while also acknowledging how sad this was and what a difficult situation I was in. And so I think that's an important fine line to walk. They embraced my family and my friends. They made them feel comfortable. They made my family feel confident when they were going home for the night to their hotel room to sleep, that I was going to be in good hands, which is an amazing gift, to send a family member off for a good night's sleep and taking care of themselves. Holding my hand through the first twinges of phantom pain I talked about today. I mean, I had heard of phantom pain. I had spent maybe a minute talking about it in nursing school, but when I first experienced it, it was terrifying. It was scary. And having them right there by my bedside. These are just a handful of, hundreds of things that my whole care team, but in particular my nursing team, was doing for me and my friends and my family.
And I think that's such an important message for all nurses to hear, because we focus so much on the physical part,
Right.
which is important,
Right.
which you would agree with
Absolutely. Is important and should be the priority, absolutely.
that, but not to forget about the passion, the mental
Correct.
things that you can do, and just the presence, the gift of presence to be
Correct.
there.
And I think ICU nurses particularly, there is an enormous amount that they are responsible for. I mean, it's overwhelming, frankly, especially when your patient's really ill. But I would argue that no matter what, that there's an opportunity for a small act of kindness, even in the busiest of shifts. And I think it's important that we remind ourselves that, because I think that's what brought most of us to the bedside in the first place.
Now, I understand you got a very special gift
I did.
in the way of this fur baby that's lying down here.
did.
So appropriately named.
Yes, this is my sweet boy rescue. He's a service dog that I received about 6 months after we were hurt. He was really the first thing that came back into our life during a time where we had lost our legs and our freedom and our plans, and I couldn't work and we couldn't go back to our apartment. It was a 4th floor walk up. And when we got rescue, he was really the first thing coming back into our life at a time marked by so much loss. And while he helps me in so many ways physically, he can fetch things and open doors and turn off lights and bring me my cell phone, as I demonstrated today at the luncheon. Emotionally, he gave me something positive to focus on as a nurse. It was something else to take care of. He had bursitis on both of his elbows because he was, as a puppy, flopping down on this hard concrete floor all the time. And when they called me to say that I'd been matched, they said he does have one small medical issue. He's nursing this bursitis, and he has to wear this crazy padding, elbow padding apparatus. And in that moment, I knew this was my dog. I wanted this dog. I was going to nurse his bursa and help take care of him, put him on a nice, cushy bed. And so from that day on, he's just been such a therapeutic presence in our life, not just for my husband and myself, but everyone else that we encounter.
Well, he's a beautiful dog, and I can't tell if he's energetic or not, but
Not when he's working. Right now, he's just kind of on call, being quiet, out of the way in case I need something.
so he knows that when he's got this on,
Absolutely.
he's got to be in a different mode.
I mean, aren't we all in a different mode when we're in our work clothes?
He's got his uniform.
Exactly.
Now, tell us about the book you wrote.
So my husband and I, very early on after being hurt, we would get a lot of stares and attention, especially from children. And some parents would kind of shield their kids from us, or I'd hear a child ask real loudly, "Mom, what happened to that lady's legs?" And the parent would kind of usher the kid out of the store and just say, an accident. And we just started to realize that kids really wanted to know and learn, and that there was a way to do it that was age appropriate. And I think Patrick and I both deeply felt that we shouldn't be something that's shielded from kids, but something that's shared. And I think rescue is just such a gateway for people to come talk to us. And he's really the gateway in this book. I think that rescue is what draws young children to it, but then they end up learning about all these other amazing things. And if we want kids to be more accepting and inclusive, I think it's important to start looking at and talking about people that are different or get around differently or look differently from us.
Well, I want to thank you so much for taking time out to give us this interview.
Thank you.